Hi, and welcome to Got Goat Productions. And thank you for tuning in to our first episode of Goat Talk Smiles, where kids' dental health is simple, stress free, and actually makes sense for parents. Um, I'm Dr. Valenzuela, your host for today, pediatric dentist, clinic director at Farmville Pediatric Dentistry, and founder of Philo Oral Care, which is a brand that specializes in kids' oral care products. I started this podcast to empower parents, help parents feel confident when it comes to their child's oral health. Um, let's be real. There's a lot of confusing information out there. So if you're a parent and ever wonder, am I doing this right? Um, this is for you. You're in the right place. So let's get started. Let's get into today's question, and probably one that I get asked a lot in practice, and that is, when should I bring my child to the dentist? Short answer is no later than 12 months of age, or as soon as that first tooth comes in, which varies. It can happen at 6, 7, 8, 9 months. And I know what you might be thinking. Wait, that's that early? They barely even have any teeth. And in all honesty, that first visit is to establish a dental home for a child, help set the tone for a child's oral health journey, and really for you to educate you as the parent, because most dental problems that I see in kids are preventable. Um, here's why that first visit actually matters more than you think. First, prevention over reaction. I'd much rather guide you early than to have your child come later with cavities and pain, fear. Second, kids who start early tend to do better long term. They're more comfortable when they come to their dental visits, less anxious, and really, dental visits just become a normal part of life. And third, and this is a big one, we can talk about habits early, such as bottle use, nursing, snacking, dietary habits, oral hygiene routines, brushing, flossing, even things like pacifiers, thumb sucking. Those little habits, they add up fast. Now, let me walk you through what actually happens at that first visit, because I know that's where parents get nervous. And honestly, it's super simple. Most of the time, your child sits in your lap. We do a quick, thorough assessment. We look at teeth, gums, we count teeth, we check for oral-facial development. Sometimes we'll do a very light, simple cleaning, but nothing aggressive, no scary tools, no pressure. Something that I take pride in, and it's something that I always taught my staff over the years, is to never force anything. Always go at the child's pace. Always show things, explain things before you do something. The child is more likely to engage with you in a positive way if you speak to them using kids-friendly terminology. The goal is simple. It's to make it a positive experience. Because if that first visit goes well, then everything after that becomes easier. So if you're a parent planning your child's first visit, I have a few quick, simple tips for you. Keep it positive. Don't say things like, "it won't hurt." Kids weren't even thinking that until you said it. Morning appointments are better. Usually kids are in a better mood. Always bring a comfort item if needed. And honestly, come in relaxed. Kids, your energy matters more than anything. Kids will pick up on everything. So if you're a parent that finds this very useful, very informative, please share this with another parent that might need it. Share this on social media, repost it. Let's spread awareness, knowledge to the public. And in the next episode, I'm going to talk about something that parents may not even know that matters a lot, and that's talk about why baby teeth are more important than we think. Thank you for tuning in, and I'll see you next time.